Hello, do you suffer with lupus, any autoimmune disease? My name is Dr. Herman. I'm with a great patient. This is Miss Ocasio. She lives in Massachusetts here in the United States. And you were diagnosed with lupus about how many years ago?
16 years ago.
Okay, and when you first were diagnosed, it was due to pain in the body?
It was due to inflammation of joints.
And there was never a rash on the skin?
No.
Okay. And so I'm going to take a pause of this video. I think you need to watch, all of you watching this video, watch what Miss Ocasio went through for the past couple of years with rashes on the skin. And when you come back and see her skin right now, it is really like night and day. Okay, so now that you saw that, you could see how purple, there was scaling, there was peeling, there was oozing, it was very bad, right?
Very bad.
And it was very irritated to you, was there itching?
It was like a really bad sunburn with itching included.
And right now, what's there looks like on your skin where we have some dark spots. Was this prior to ever having the lupus diagnosis 16 years ago? Did you have those type of sunspots on your skin, or is this only now right after these lesions have cleared and we have a bit of scarring that's there?
After the, I guess after the rashes, really what you see is scarring. Before the rash started, the only thing I had was just a little discoloration here, what you see here. It was a little less, and I actually, now that I think of it, I don't know if you can see a little bit of the rash on the eyebrow, but before I started treatment with you, all I had was these little spots, but that was all I had for rash. My main problem was the swelling of the joints and the pain.
And so
the rash started after the treatments.
Yeah, so and we'll help everybody understand why the rash started after the treatment, and there's a specific reason which we're going to get into in just a moment, so stay tuned. So you're originally diagnosed with lupus through blood test, and they found that you had swollen joints and painful joints. And your original diagnosis before the lupus, they thought it was juvenile rheumatoid arthritis, right?
Correct.
And treatment that they gave you for the juvenile RA, did that make any difference?
No, I felt absolutely no difference, and my condition just seemed to be getting worse.
And after that, then they realized through other testing, they realized it was lupus.
Correct.
And when they started you on the medication for the lupus, for this autoimmune disease, because they're telling you that it's your body attacking itself, right?
Correct.
Yeah, so when they told you that, they gave you some immunosuppressive meds, and what else did they give you originally?
Originally, they gave me ibuprofen. They told me that a mix of ibuprofen, prednisone, and at the time, Cellcept and Plaquenil. There was another medication, I can't remember. There have been many medications. They were basically experimenting with me until, according to them, they believed that the Cellcept and the prednisone and the Cellcept, prednisone, Plaquenil, according to them, the three combined would help, but they really didn't.
They didn't help with the joint pain?
Correct. It was according to the doctors, it would reduce the inflammation caused by the lupus, which would reduce the pain. But I didn't feel any reduction of any pain. I felt the same.
You felt the same. And so with those three meds, two immunosuppressives and a steroid, and maybe some ibuprofen from time to time. And did you, so in addition to feeling no pain relief in the joints, we're making that very clear, there was no pain relief in the joints. You also told me that something else happened to your body as a side effect caused by the medication. What was that?
That's right. I believe it was in 2012. I thought I had a stomach bug. I had diarrhea and vomiting for over 4 days. On the 5th day, when I went to the hospital, they discovered that I didn't have a stomach bug. What was going on, according to 3 doctors in the emergency room, I was suffering from some kind of stomach ulcer caused by either the Cellcept or the Plaquenil is what they were discussing. I never got a complete answer, but I know that the doctors were saying that I guess I had a stomach ulcer and some kind of infection in my intestines caused by the Cellcept or Plaquenil. And that's when I was like, well, they said that there was no actual medications for lupus. So when I heard that and ended up in the hospital suffering, I said, no more. I'm not taking those meds because obviously they're hurting me after so many years.
And so we know that immunosuppressive medications, what they do is they suppress the immune system. And so I'm going to make a point right now that the immune system's job is to attack infections that are in the body and help you rid those infections. Now, I believe that autoimmune, and this is from my research, postgraduate in neuroimmunology, and I was taught by one of the world's most recognized immunologists who's over 40 years in the industry. He had pointed out through dozens and dozens of lab papers that the scientists around the world who were not funded by drug companies proved that there were different infections, viruses, bacteria, parasites, fungus, and or mold that are in tissues that make people have these inflammatory responses, situations and diseases, whether it's lupus or rheumatoid arthritis or Hashimoto's thyroid disease, and there's more to that. So when we can find these different infections and toxins and get them out of the body with a safe and effective method, then we can rid the inflammatory mechanism that's going on with the cause of the inflammation, the cause of the autoimmune disease. So with you stopped those meds because A, they found that you had ulcer, and B, they realized that that if there was infection, which they couldn't detect through their testing in the hospital, but they said that if there's infection, it was caused by you taking the immune suppressive med, because you're actually stopping the immune system from fighting the infection, and you still have no relief of joint pain, zero. So you stopped taking those meds, and then you started coming to me. And let's just fast forward to about 2.5 years ago. So when I found, and we're going to go back and reflect here, I'm going to put a picture up on the screen of how bad the rash became. But when you started taking the remedies to pinpoint, because there was maybe 20 or 30 different infections that I found in your stem cells where the blood is made in your bone marrow, when you started taking those remedies, and the purpose of the remedy is to help the body get rid of the infection. And the infection, I'm telling this to other people, you already know this, what you're coming to me for, is to get the infection, to get the body to expel the infection some way. So one way that we can expel infections from the body is through our stool. We can expel infection through the urinary tract. We can vomit out infection, just like somebody who gets what we call food poisoning. We throw up to get, because the brain and the stomach know get rid of something that's harming us in the stomach. It's not poison that's in the food, it's infection in the food, like a parasite or so on, that upset the stomach. We can have infections leave through our respiratory system, and we can have infections leave through our skin. So what happened with Mesocasio, when she started taking these remedies I provided her, the body started getting rid of those infections that were in her bone marrow that caused a lot of the pain in the body and caused the autoimmune disease down to the DNA level. It started coming out through her skin. So the rash presentation you see in that video that she generously shared with me for everybody to learn about this, it started coming out through her skin, and that lasted for you, and it got worse and worse and worse, and it went on for about how long?
It's been 2 years, but I think it's over now.
Yeah. So 2 years. Well, let's say when you say you think it's over now, how many months have you been with your skin looking like this now, which is a huge improvement from what it was. So, right, we can admit to that. It's a huge improvement to what it was.
Definitely.
Definitely.
Feels better. It looks better.
It looks a lot better. So how long has it been this way with your skin as opposed to with the rash that was there before?
It has now been a year since the last time I had some kind of skin flare.
Okay, so a year. So we hope it's over. So only because because you know what we're still going after. Is that what you said there? Because you know the infections we're still finding.
Exactly. I'm sure the remedies might pull something out that's lingering around. So
it might pull it out of the skin, but maybe you'll just pee it out or poop it out or something else. So let me ask you, your medication you were on when you first came to me, you were still taking prednisone?
mm-hmm.
And how many milligrams a day? And there was no Cellcept and no Plaquenil?
No.
Right. So you were on how much prednisone when we started to do these protocols to get rid of these infections? How much prednisone were you on a day?
When I first started with you, I was on 20 milligrams.
And how much are you on now?
Today I'm on 5 milligrams.
And how long have you been on 5 milligrams?
I have been on 5 milligrams for roughly a year now.
Now, the reason for the steroid, the prednisone, is to decrease inflammation in the body, right?
Yeah.
And so we know that the infections were coming out of your skin because of the remedies that you were taking to get rid of it that way. And you went to the hospital where they saw the skin, and what did they say when they saw that?
Well, they say that it's because I'm not on Plaquenil,
mm-hmm.
but they were just asking questions. What did I eat? Asking about the flare, lupus flare, but they really don't treat it. They did give me some creams, momentazone, I believe it was called. It really didn't help. There were steroidal creams, and I just didn't really want to use them because I felt absolutely no relief.
No relief. And then the rheumatologist also you had seen in private practice, and what did that doctor say? She thought you needed the Plaquenil.
She still insists that I take Plaquenil, and she wants me to get back on those medications because she insists that my skin is like this because of the lack of Plaquenil.
Now, you refuse. Why do you refuse?
I refuse because I've been on those medications for so many years and suffered so much, and why put another drug in my body? That's not helping.
Yeah. And so you suffered so much because it caused ulcers.
Absolutely.
And you still have the joint pain. So while it caused you other suffering, but it didn't help you relieve the symptoms that it was supposed to be used for, right? So,
right.
And now you're down to 5 of the prednisone, and your skin, the point I'm going to make is your skin has cleared up so much, so impressive, the difference from then till now.
Mm-hmm.
Your skin has cleared up without increasing the prednisone.
Correct.
Your skin has cleared up without taking any kind of immunosuppressive medications.
Correct.
Right. And it's going to be even better now. The skin is going to be even better than where it is. It might take another few months for that to get even better to a better complexion, but we're in a huge difference. So again, no immune suppressive medications to get rid of those ulcers that appeared on the skin, or those skin scars and rash, that whole terrible purplish looking appearance, and no increase in prednisone and no other medication, and there was no topical ointments that would take it away. And it was the body had to do its own healing. The aggravations that occurred, the body was going through a healing process, and it cleared up.
Mm-hmm.
But how much better do you think when you look in the mirror now and other people around you, your family and your friends, see you and meet with you and hang out with you, what is their expression compared to what it was a year and a half ago? What do they think?
A lot better. I mean, when I see family members that I don't go out much anymore, but when I do go, everyone's impressed because they did see what I was looking like before, and it was awful. I mean, everyone would cringe when they looked at me because it just looked awful, and everyone feels bad because they're like, oh, poor girl, how are you feeling? Everyone wants to help, but no one can help. So when they see me now, they're like, oh, you look so much better. How are you feeling? You must be fine. And it's great to hear that, but honestly, I'm not 100%. I'd like to feel as great as I look to them, but I know that we're getting there.
Yeah, we're getting there. So, but I appreciate you letting me share this with everybody out there. And I really appreciate your strength of what you being a strong person to go through what you went through. You're not the first person who's taken a remedy to get rid of infection where the infection came out through the skin. I've got many images from patients where they took remedies to get rid of the infection that was causing a kidney problem or a stomach problem, and it came out through the skin. And the body, it's like I explained to people, as I might have explained to you before, it's like a volcano erupting. The earth, we can look at that from afar in a movie, like we're watching a movie, we see a volcano eruption because the earth had to get rid of some pressure and it let it out that way. Well, your body had to get rid of some infection and it let it out that way. And that was fortunately and unfortunately. Fortunately, it's the infections are gone from you. Unfortunately, you lived through a terrible eruption, and that was your body's own expression. And it's very common that we see those. So I appreciate you being so strong and sticking with us and understanding. And I appreciate you letting me share these images that you took from me to share this with everybody. And we're looking forward to even more improvement for you.
Thanks.
You got it. Anything else that you want to say at all before I cut off the recording?
If there's anyone else suffering something like what I'm suffering, just hang in there, because you know what? This too shall pass, and I'm going to make it.
Yeah.
I believe it. Thank you for that.
Yeah, you're welcome. But I don't think it would just be making it by just going on a gluten-free diet.
No. You got to put a lot of work. It's
been a lot of work and dedication for you, right?
Absolutely.
A gluten-free diet doesn't do it. A dairy-free diet doesn't do it. Taking more of the immunosuppressive medications couldn't do it for you. Meditating couldn't do it for you. Taking a vacation couldn't do it for you, right? It's been a lot of work. Yeah, it's been a lot of work. So I appreciate you.